Kerataconus and Sjogrens. Two things we're going to be talking about today. First one is keratoconus. Okay, keratoconus is, let's give the definition of keratoconus first. Keratoconus, I had keratoconus also. It is like the thinning of the cornea. And what it is, it's a deterioration of the cornea, thinning of it. And that's how they do cornea transplants. So, like, I have cornea transplants in both eyes because what it does is it affects your vision and you're not able to see properly, and it's like an oval shape like a football where it'll be kind of flattened. I'm also going to have some pictures to show you an example of what that look like also, but it gets pointed like football, and it's thins, and you really can't see, you practically can't see. Well, a lot. It'd be very, your vision is very poor when it does that. Okay, so here is the little briefing on the keratoconus. Keratoconus is an eye disease that causes the cornea to thin and bulge into a cone-like shape, resulting in blurred vision. Keratoconus is a progressive disease that begins to affect people in their teens and early 20s. Keratoconus occurs approximately in 1 in 1,000 people, and I would be one of them 1 in 1,000 people to get it. Let's see what else does it say about the keratoconus. Let's see. I'm trying to see what else it says something about else about the keratoconus and how it runs. What's the causes and the symptoms? Trying to find that one also. Give me a minute. I'm looking on my tablet. Okay. But yeah, I have keratoconus. What I'm doing is I'm going through the listings of all the different things that I have. I believe it's as a result of the lupus. And like you say, with the lupus, there are a lot of symptoms and other little things that attach to it. That may be the lupus, but it's other things that attach to it. And I'm going across and covering the different ones that I have right now. So I have about a few more to go. So far we've covered Raynaud, and I was gonna do the rheumatoid arthritis tonight, but I was like, no, I went out and I came in. I was like, no, I think I'm gonna talk about the Sjogrens and the keratoconus, and the reason why I blended it together because it's a little story behind that. Because like with the lupus, they have you take medicine and something Plaquenil. So that was all involving that one together. So that's why I opted out and just brought that in together. Okay, like I said, I got cornea transplants in both eyes. So now I see good. Also, so I have the different eye drops that they have you put in it and everything, and I have dry eyes also. So I have to put that expensive medicine called Restasis. I have to put that in there, but it's patent, so it's nobody else don't make it right now because it's licensed. So I'm using that, and I have, like I said, my pressure a little high, so they got me on some other things to assist with that too. But I can see, so I thank God I could see after the correction, and the doctor came in and did the surgeries on those 2 cornea transplants, so I can't see. So this now leaves me when I was doing all the different tests for the lupus. So this is when my primary PCP, said, I'm going to give you Plaquenil. And she said, okay, you have to go to your eye doctor and run some tests, because to take this medicine, it may affect your eyes or something, and you say you have cornea transplant. So I'm like, okay. So I went to the eye specialist and ran all these tests. Ran the test, and the result came back, and he told me I had Sjogrens. So I said, okay, I have Sjogrens. Yeah, because they was going to put me on Plaquenil, but he the one told me I had Sjogrens. Now, Sjogrens is, let's see what that one, I was looking up all of them before I like I told you, I read everything. And this because when I was going through so much and they was giving me so many things, I have to read. You have to read, and you have to know what the doctors are telling you. And so you have to read and Google for yourself to see what it is they say you had. So I always read everything and get an understanding, because you got to put all these different things together. So here's the episode. Here's the definition of Sjogrens. Okay, Sjogrens Syndrome, with gland inflammation resulting in dry eyes and mouth, etc. That is not associated with another connective tissue disease is referred to as a primary Sjogren's syndrome. Sjogren's syndrome that is also associated with a connective tissue disease such as rheumatoid arthritis, systematic lupus erythematous, or Sjogrens is referred to as a secondary Sjogren's syndrome. Dryness of eyes and mouth in patients with or without Sjogren's syndrome is sometimes referred to as Sika syndrome. So, right here, when the doctor told me I had Sjogren's, and he told me that the medication, the Plaquenil, would affect my eyes because I have cornea transplants. And in time, over the years, as I continue to take that, it can affect my vision. I can go blind. So I said, oh, okay. So I said, that's when I was like, okay, I'm not going to take this, what they're trying to give me to help me with the lupus. I said, I'm not going to take this. And this is when I said, well, Lord, if I had to lose anything, I don't want to lose my vision. You know, when you stop breaking down and narrowing it down, I said, well, I was like thinking, okay, if I couldn't hear, what I could do, if I couldn't do this. And when I regained my vision, because it was a slow process with the kerataconus of my vision fading on me too. I didn't understand. I didn't know my vision was going bad like that. When I first went to the regular eye doctor, and he kept running tests and different things, trying to do the eye exam, it was like something else going on with your eyes. So he referred me some glasses, and I still couldn't see because the kind of work I did was on the computers and everything all day. Still was having a little trouble. And then I said, I'm going to get some LASIK surgery. That's what happened. I said, I'm going to get LASIK surgery. So I made the appointment and was going to go get some LASIK surgery. And then when I got there, that's when they determined, they was like, we need you to sit to the side. They say, you have something else going on with your eyes. And so I'm like, okay. So I sat and I waited on the doctor. He took me in the bag. The guy that was the laser doctor, and he started telling me about what's going on in my eyes. And so he the one told me I had kerataconus. And he referred me to a specialist that I need to go to, because you couldn't just do LASIK surgery with the problem I was going to have. He said I need more severe, more intense surgery. So once I went to the other doctor, that's when they started talking about all the cornea transplants and everything. And it's just like a heart transplant or anything else, you have to see about it. So I have to make sure I take my medications for my eyes and keep them moistened, because I can have dry eyes. I do have dry eyes. So that's where the Sjogren's come in, and it dries your skin, and it can make your teeth come out also, because you're supposed to see a dentist also. And this is what it did do. It pulls the moisture, so that's why some of my teeth have come out, because of the Sjogren's pulling the moisture and drying. So I'm constantly drinking water all the time to make sure that I keep fluid in me, because of the Sjogren's syndrome I have. So I don't take I don't take the Plaquenil. Like I said, it was giving me so many things until when I was like, I didn't worked hard and got these cornea transplants and everything. I don't want to mess this up, so I don't take Plaquenil. I put that one to the side, and I would take it every now and then, but I just think about my eyes and everything I went through with my eyes and surgery and everything, and I put it to the side. So that's with, like I said, that's why I'm talking about the keratoconus and the Sjogrens tonight, because they both affected the vision. They both was a poorness with the drying, the tissues and different things with that. That's why I blended two together to talk about that. Those are a lot of things, side effects. I think they said with the with I think Sjogrens. Yeah, the Sjogrens, they said lupus and um, systematic. Oh yeah, that's for the children. So lupus, you usually pick that up a lot. So that was discovered also. So I had pamphlets and I was reading on that. I'm going to have a picture of that, also a little illustration of children's, and also the children's symptoms. I will have an image of that available as well. It's an autoimmune disease. Yeah, they say it's an autoimmune disease that causes symptoms that include arthritis and dry eyes and mouth. And then it's like you can read about more of the diets and the complication treatments, diagnosis, medications, and signs. But like I said, the doctor, the eye doctor, told me that every 6 months I would need to come into him where I could take these series of tests where they can run the tests behind the eyes. They take an examination to make sure, because of the plaquenil that I will be taking, I need to come to him to take a special test on that. I said, oh, okay. Because I'm like, I ain't gonna worry about that one. That's one. So, like I said, I kind of turned that over to somebody else too that I know that can bring me through that one. Sometimes you have to go to a high power and pray to get over some of the things. Like I said, when you're given so many cases against you and different, all kind of issues, you have to learn how to put them in their places and say, well, this is for this and this is this, and I'm not going to do this. And also with children's, when it made you dry because of what it did, you can't really go. Well, I don't know if that's blended with that one. Can't really go out in the sun because I have a vitamin D deficiency also, and I believe when I didn't know I had the lupus, I went to a water park with my family. We went to a water park, and I got overheated, and I got so tired and everything till I had to go. I was like, I gotta go to the car. I was like, I just can't take no more. I guess the sun, with lupus, you can't be in too much sun. So I was like, I can't take this. I got to go in. So I went and sat in. One of my girlfriends, went with us. So I got her key and I just sat in the car. And I mean, I was so tired. So now I have to make sure I'm covered up because I can't be in the sun. I wear sunscreen lotions. I make sure I'm covered, so I make sure I always have something over my arms and my hands most time. But I could wear short sleeves. I do pretty good. Like I said, I thank God for that one, because that could have been a different take too. So, again, tonight, I talked about kerataconus and Sjogrens. So those are two things also that I suffered through and went through. And like I said, with the kerataconus, that has been resolved with the transplants, but I use Restasis for my eyes. I know because that's for dry eyes, and the Sjogrens make it be the dry eyes, so I make everything sure that everything is balanced and take care of, and I keep moving. So I'm gonna end this for tonight, and like I said, I can show you one of the little valves for the Restasis. I can show you what I have right here. So this the little valve. I do the little valves they have. So this one, you put one in your eye. You put one in the morning and one at night. I can get this. Actually, I can get 2 usage out of this because I use one a day. I could put one in the morning and one at night before you go to bed. So this is Restasis. This is very good. It keeps your moisture because I have dry eyes. So I'm gonna close out tonight. And in my closing, love and hugs straight from the heart. Thank you for watching A.S. at Night. Take care.